In this lecture, we're going to introduce you to emotion-focused therapy, sometimes referred to as emotional-focused therapy and sometimes EFIT, emotion-focused individual therapy. So there's a number of names floating out there. Regardless of the name, this constitutes an empirically supported evidence-based treatment. And it is as I'm going to talk about here, it is a contained treatment, meaning like it's an empirically supported manualized based treatment. It was originally developed for use with couples and has been expanded for use with individuals as well. So we'll talk about this because of the focus of our class, primarily from an individual perspective and how you would do this with your individual adult clients. But this is something that can also be used for couples work if that's something that you're interested in. I want to start with some brief background in introducing you to what exactly EFT is. And one of the things that you'll probably hear me say in class, and one of the things that I think about when I talk about EFT is, like, for many years I just didn't think much about EFT. I didn't read much. I always wonder why. And part of the difficulty for me personally when I read EFT is, like, I think the writing is difficult to decipher. It's very dense, it's very thick. The writers are very, very good, but sometimes I don't think they bring it home in a way that's kind of easily digested by folks. So it takes me a long time to actually read through things. That may just be my own intelligence, but whatever the case, it is what it is. I'm going to give you four background things here really quickly. One, the EFT is based on a combination of different theoretical orientations, including attachment theory, humanistic and existential, client-centered, Gestalt, and experiential traditions. That's a lot, right? But the thing that a lot of them have in common is the focus on making meaning and being attached to our world, our environment, our internal states. I'll leave it at that for the moment. One of the things to point out, I think that's important in there, is like a lot of this is based on modern day attachment theory, and there's a lot of discussion about attachment theory in these writings, which I think is interesting. The second point here, I'm going to actually put on my here. The second point here, and these next 2 points are direct quotes from your reading for this week. The first one is that EFT focuses on working with, and I'm going to read it to you, focuses on working with clients experientially with the client's emotional processes with the aim of enhancing capacity to adaptively process emotional experiences, thus facilitating adaptive action in the world. This is an example. Both of these are examples of, like, holy cow, this writing is dense and complex, and I have to, like, read a sentence and then stop and think about what that sentence actually says. To me, what this sentence says is it's important for our clients to experience their emotions. And this particular theory focuses on clients experiencing those emotions and differentiates between adaptive emotional processing and maladaptive emotional processing. And the goal of the theory and the goal of the therapy is to facilitate that adaptive, functional, emotional response to the world. There's my interpretation of that one sentence. If we move over to our third point, EFT is a marker-driven, task-focused experiential psychotherapy whereby clearly defined in-session client presentations prompt the therapist to initiate specific research-informed therapeutic tasks with the aim of facilitating specific in-session emotional processes. Whew. And all of this is done within the context of a facilitative therapeutic relationship. Wow, a mouthful, right? What does that mean? Well, marker driven, it means that we see certain things in the therapy session. There are these markers. When we see this in therapy, when our clients talk about things in a certain way, we then engage in certain tasks. These tasks are experiential in nature. So we're not just talking about things, we're having clients experience things, right? Be in touch with the emotional context and content of a particular thing that we're talking about. I already mentioned the client presentations, specific research informed. The other thing here, like these come out of process outcome research that we've talked about, where we look at what happens in a particular session, what happens across sessions, and how are these specific things that happen in the midst of a session related to therapeutic outcome. So we're really talking about things that in the research literature have been found to produce positive outcomes in psychotherapy, and not just like final outcomes, but produce therapeutic change throughout the therapy process. And these things are done. The last part of this, right? I told you this is a complicated sentence. Facilitating specific in-session emotional processes. What happens? What this is getting at is that within the therapeutic session, we want specific in-session changes to occur. We expect our clients to undergo and experience their emotions in a different way than they used to. And then the final part of this, right? What have we spent 5 minutes on one sentence here? It occurs in the context of a facilitative therapeutic relationship. This is no different than we've talked about the relationship all semester. It involves collaboration, it involves warmth, it involves validation, it involves agreement on tasks and goals of therapy. So all of this stuff that we just outlined here it occurs within that therapeutic relationship. And that therapeutic relationship is often talked about as one of the first and most important parts of doing EFT proper, if you will. The last point, and a very quick one, is this was developed with couples, as we mentioned before. The first individualized transformation of this was with surprise depression. But since that time, it's been researched and evaluated with a number of different clinical presentations. And it's often thought about and talked about as a transdiagnostic approach. We haven't used the word transdiagnostic a lot this semester at this point. I think it's pretty self-explanatory, but just in case it's not, transdiagnostic simply refers to the idea that you can use this across a variety of different diagnostic presentations, and it's not specific to one diagnosis or the other. So let's talk a little bit about the concept of emotion schemas and self-organization. These are really important concepts to doing emotion-focused therapy and conceptualizing, easy for me to say, within this particular model. We're going to talk about two things here. First, what are emotion or emotional? And they keep using these words simultaneously, but it bugs me. But what are emotion schemas or emotional schemes? In essence, we've talked about schemas throughout our time together. And schemas are these underlying kind of organizational structures, and they contain both cognitive, behavioral, emotional, and even motivational elements attached to them. Within EFT, we're focused on the emotional component to that. And in my experience therapeutically, the emotion is either often the thing that is most present or least present when people talk about them. But that's what they are. They're these kind of underlying organizational structures of our experiences, our memories, etc. And all these things are tied together: the emotion, the behavior, the cognition, the motivation. Some of them more finely developed and some of them developed at more rudimentary levels. In my experience, often based on when a particular experience happened to the individual in their developmental trajectory. So how do we use these concepts in therapy? One of the primary goals in EFT is to change the emotion schemas and to change the self-organization in a way that they're more functional for the individual. So oftentimes, either these emotional structures and schemas are, and to be very simple, over-controlled or under-controlled are the two of the primary presentations we'll see. So I'm like not experiencing any emotion, even though there seems like there should be emotion, or I'm just emotionally overwhelmed and like I can't even control my emotions. And part of what we want to do therapeutically is to change both those under controlled and over controlled emotional schemas to being controlled, appropriately mature, functional for the client. So let's talk a little bit now about how does therapy actually work? What does it actually look like? And there's different writings or there's different ways of talking about this. I'm going to try and break it down in the way that I think is the easiest to digest for you at the moment. And I'm going to do that in kind of a 3-stage process model for EFT. The first stage in this is not surprising if you've been paying attention this semester, which I know you all have been. The first part of any good therapy is establishing a good therapeutic relationship. And this is no different in EFT than it is other therapies. We're going to agree on goals and tasks. We're going to establish a warm bond, a connection with our clients. We're going to validate their experiences. We're going to be emotionally present. We're going to listen. All those good things that we've talked about so far this semester and more. The thing that's perhaps unique about EFT is the initial part of this relationship is also focused on increasing emotional awareness. What does that mean? Number one, it means that we're going to kind of provide some rationale as to why emotions are important. And this may be a simple statement of look, we emote. We're human beings. We emote. And that's important. And that's an important part of why we're here. Part of why you may have come to see me is the fact that you're experiencing difficulties with emotion. And so obviously then a focus is going to be working with that emotion. The other part is we're going to, and as the title, or I don't know, bullet point here implies, we're going to work out with our clients to become more emotionally aware. And emotional awareness could be labeling emotions, talking about emotions, discussing emotions with another person, realizing when emotions are there, when we don't realize they're there. So like attending to our body and what our body might be telling us is one of my favorite techniques anyway. So what is the emotion? Where is it? Where is it located? What does it feel like? How can you describe it? All of that is an aspect of emotional awareness. And then, the other thing, obviously, in here, I think I'll just repeat it, to be honest with you, is that collaborative focus. So to make sure that your client is in agreement on the focus of therapy. And I always like to pull back for a second here and remind you that in EFT proper, this is going to be an initial part of what you do. If I'm doing a more integrative and eclectic, which, as you know, at this point in the semester, I am a fan of, this may be something that you introduce at various times in the therapeutic work. I just had a client, for example, that I was working with that I said, we've been doing a lot of work in blah, blah, blah area. And one of the things that's become clear to me in our work is that a lot of times when we talk about emotion, you pull away from me and pull away from that topic. And I'm wondering if in the work that we're doing moving forward right now, we can focus on emotion and we can focus on what that feels like to you versus your talking about and thinking about it. And so in that very simple statement that I made to my client, there's a way that I'm shifting away from this kind of intellectualized based content to an emotionally focused content and emotionally focused work. And that was like a transition from work that we'd been doing to what we want to do. That could happen in a session, right? Where I focus away from what you're telling me about and thinking about to what you're actually feeling. Either way, we want our clients to be collaboratively involved in that process. The second part of EFT and perhaps one of the main areas that you're going to focus on is kind of evoking emotion and having clients kind of experience emotion in the session with you, and in doing so, explore what that emotion is, means, what it's related to, etc. So, there's part of what you read this week about, like, what is the sweet spot, if you will, in terms of emotion. In therapy, the sweet spot is where I'm emotionally present. Like, I've got emotions flowing through me, I'm feeling them, but I'm not overwhelmed by them. And that's what evoking emotion means. Like, we want clients to be in tune with, in touch with, feeling the emotion, but we don't want them overwhelmed by them. That's the sweet spot of therapy. And then when we've got clients in that sweet spot, and those are Dr. Ha's words, not technical words, we want to explore them. What did it mean for you? What does it mean about you? What does it mean about other people? Tell me more about that emotional experience, right? Is there anywhere that emotional experience takes you to? Those are all exploration questions. And then the final part of EFT, and I think this is one of the kind of unique parts of EFT, is this idea of emotional transformation. And what we mean by emotional transformation is I want to take you from a rudimentary, reactive, dysfunctional kind of emotional state to someplace that is mature, functional, organized, emotional experience. And we do that through that process of exploration with our clients and helping them to understand what these things mean to them, about them, for them, about other people, etc. As I close out this lecture and add some finishing touches to this, I wanted to just talk about a few important concepts as they relate to EFT. One is the idea in the differentiation between primary adaptive and maladaptive emotions. And this is a really important thing. And the way that I describe it to clients is I will often say, look, our emotions are really important and they serve adaptive functions for us. Your emotions, and I don't say it this strongly, but your emotions have come to serve these maladaptive functions for you, these maladaptive purposes for you. And what we want to do in therapy is to transform that maladaptive emotion to more adaptive emotion. So let's talk about what primary adaptive emotions are. And these are emotions that serve a function for us. They've served a function for us individually. They've served a function for us historically in evolution, from an evolutionary perspective. I work with anxiety a lot, as all of you know at this point. And I say, well, like, why is anxiety there? Why do we have it? Well, anxiety points us in the direction of things that are dangerous. And in doing so, it alerts our body that we need to respond and we need to adapt to whatever's going on in the environment to preserve our safety. That's adaptive, right? When someone I love passes away and I feel sad and I'm torn, or not torn, but I'm drawn toward other people in my life to comfort me and to help me and to I don't know, to help me through it. Like, that's adaptive, right? To turn toward other people in times of loss. Those are primary adaptive emotions. Primary maladaptive emotions are these emotions that seem to come kind of out of nowhere, or they don't seem to be in direct relationship to what is going on in my environment. And in turn, they don't really allow me to necessarily respond in the most adaptive fashion. So if you're talking to me and my emotion is like, oh, you're dissing me, you're like putting me down, and you're not. like my maladaptive emotion may lead me to act out, to engage in conflict with you, and that may not be adaptive for me in that particular situation. So those are the differences between these kind of primary adaptive and primary maladaptive emotions. Adaptive meaning they lead me toward my goals, they help me facilitate and function well in relationships. Maladaptive seem to come kind of out of the blue, out of nowhere, related to previous events in my life, and they don't necessarily help me adapt and function appropriately to relationships as they are right now. I'll end on one caveat here. In this question of like functionality is important here, because and this goes into like schema therapy. It's beyond the scope of our class, but something that I'm very passionate about. Right, this idea that like of functional dysfunctional. Historically, what we want to acknowledge to our clients is that the emotional response you're having right now may have at some point been functional for you. If I grew up, for example, in an abusive household, and my response to any feedback is to shut down and go into protective mode, that at one point in my life was functional. Right now, if my partner gives me some feedback, and in response to their feedback about what I'm doing, I shut down and withdraw, that's not functional right now in that relationship. So when I'm talking here about functional dysfunctional, you have to consider the historical part of where that emotion may come from for your client. And it's important to distinguish for them the idea that at one point in your life, this may have been functional for you. Right now, and based on what you want to do right now in your life, it has now become dysfunctional and maladaptive. So just a few other things before I let you go in this lecture that I think they don't necessarily fit anywhere clearly, but I think they're just really important things to kind of mention before I conclude today. One of them, and I mentioned this in an earlier slide, I believe, but the authors talk about emotional arousal. And obviously, one of the things I hope that you've taken away from this reading and these lectures and videos that you've looked at is the idea that getting in touch with emotion, having clients emotionally invested and involved in their therapy is important. The other thing to be aware of is that that has its limits. And I believe it's actually a DBT concept or something talked about in DBT a lot, is this idea of like the window of emotional arousal. And I'm butchering, there's actually a better term for this, but it doesn't matter to me that you know the term versus the concept. The concept is that our clients function really well within a particular emotional state. And if we go beyond that, they're just going to shut down. If they're not emotionally involved and attached and in processing, then it's not going to be as effective. So we want them in this optimal emotional arousal state in order to do good therapy. I don't know, I'd be a liar if I said I know the research on this, but I know my clinical experience is that I'm bored to death if my clients aren't emotionally invested, and I'm scared to death if my clients are too emotionally aroused. And so ultimately, my sweet spot is when clients are aroused, they're attached, they're into what's going on, but not overly so. And then if they're not at all, then like I'm bored and I want to fall asleep and end a session. So think about that. Like I wish I had a better way to tell you how that is. You'll know it when you see it. If you find yourself bored, your client's probably not emotionally invested in what they're saying. If you find yourself going, oh shit, what do I do now? Your client probably needs to be walked back down out of the emotion and brought into an emotional space where they feel safe, comfortable, maybe not comfortable, but safe, controlled, period. The second thing is that you've read a lot this week, and we haven't talked about them as much in our class, but you read a lot about what are called experiential strategies. And you might say to yourself, well, what does that mean? What is an experiential strategy? And this is really a technique in the same way that a thought record is, or the same way that providing psychoeducation is. Experiential strategies are strategies in which you attempt to engage your client in their experience of particular situations. So I had a session recently, for example, where I said, look, you keep talking about your mother. I want you to talk as though I am your mother. And you all know me, like, I don't know, I'm not someone's mother, right? But I said, I want you to talk to me like I'm your mother. What would you say to your mother? And the idea here is I want you to come in contact with what that experience might be like for you. I had another session that I can remember where I said, I want you to remember what it was like when you were 14 and this thing was happening to you. Like, what did that feel like to you? What was the experience like for you? What did you see? What did you think? What did you feel in that moment? And even as I'm saying these things to you and you can't see me, but I'm like closing my eyes because I'll tell my clients, like, just close your eyes for a second and take yourself back to that situation, to that moment, to that experience, and tell me about that. And so experiential strategies are all about kind of opening your client to the experience, into the memory, to the thoughts, to the feelings of what that thing was like for you. And the idea is that the more I can come in contact with that, and especially the maladaptive aspects of that as they're recorded, the more I can transform them in therapy to more adaptive experiential moments for me. And then the final thing, and I just I love to point this out because I talk about it a lot, and like sometimes I think students recognize this and sometimes they don't. But these authors, just like almost every author we've read, and I do not pick these out intentionally. I do not pick them out to like, oh, I'm going to pick out articles that support Dr. Hall's theory. Nope, that would be stupid, and it would take too much of my time. I pick out articles that I think are really good, that are written by great scholars and great leaders in our whatever psychological community. And it just so happens that when I pick them out, they also talk about these things. And these authors talk about case conceptualization. I think they talk about it in a cool way, and not cool like in like you're a cool person. Like, this is just a nerdy cool way in my experience. But in my nerdy cool way, they talk about case conceptualization as this like ongoing fluid process, that it isn't this static, like, oh, you come in, I hear your diagnosis, here's my conceptualization, here's my biopsychosocial conceptualization and assessment of where you're at and why you're at. Nope, 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 nope. Here is my conceptualization of what's going on in this moment with you as we live it together, right? Like, that's like much more challenging and much more cool in my experience. And again, I use the word cool lightly here. But anyways, hope you enjoyed this lecture, and hope you learned something about EFT. There's a lot more than we can go into here, but hopefully this gives you a nice introduction and gets you started on your journey of understanding and using emotion in your psychotherapy work.